The greatest battle many of us face is the one with ourselves. Today, we're tearing down the walls that keep mental health stigmatized and hidden. Did you know that 1 in 4 people will experience a mental health condition in their lifetime? Stigma, discrimination, and disparities act as significant barriers for millions of people grappling with mental health conditions. To frame this conversation, it's important to understand what it's like to live with a mental illness. So, for any of you who have been lucky enough to escape the grip of mental illness, this is what it feels like. Imagine a dense fog settling over your mind, obscuring clarity and casting a heavy shroud over every thought and emotion. Each day becomes a battleground where the very act of getting out of bed feels like an insurmountable feat. Thoughts ricocheting through the mind, distorting reality and feeding self-doubt. It's like carrying a burden that no one else can see. It's as if time slows down and even the simplest tasks require immense effort. Social interactions become a tightrope walk, the fear of judgment and rejection a constant companion. Yet, within this fog, there are flickering moments of respite, tiny beacons of hope that pierce through the darkness. It's a journey of ups and downs, of resilience and vulnerability, where strength is forged in the fire of adversity, and the smallest steps forward become monumental victories. Living with a mental health condition can be an arduous journey, encompassing emotional distress, strained relationships, employment difficulties, and financial instability. The internal battles are often accompanied by external challenges stemming from social attitudes and inadequate support systems. The burden of stigma and discrimination compounds the already significant struggles of living with mental illness. So, why does mental health stigma occur? Mental health issues do not discriminate based on race, gender, socioeconomic status, or any other characteristic. Marginalized communities often face additional obstacles such as systemic racism, poverty, and discrimination, which can further exacerbate their mental health burdens. Ensuring equitable access to mental health resources for everyone requires addressing these intersecting factors. Accessing appropriate mental health care poses significant challenges. Barriers to care can include high costs, limited availability of mental health professionals, inadequate insurance coverage, and geographic disparities in service provision. Many of these are made harder by the fact that it is often difficult for those with mental illness to work or have steady income. Additionally, cultural and linguistic barriers coupled with discriminatory practices impede access to culturally competent care, perpetuating health inequalities and denying people the support they need. The impact of mental health as a social justice issue extends beyond individual experiences to the broader mental health care system. Systemic disparities and discrimination within healthcare contribute to unequal treatment and outcomes for those with mental health conditions. Advocacy efforts must focus on dismantling these barriers and promoting mental health equity. Achieving mental health as a social justice imperative will not only improve individual lives, but also foster a more inclusive and compassionate society as a whole.